Hi, I'm Tim from Precise Medical Supplies, and I'm going to show you how to set up your new aspirator. I have here the touch-up aspirator from MD Resource in the United States. It's a small portable aspirator, only weighs 3 kilos. What I'd like to do first is just run through the various parts of the aspirator with you. First, we have a dial on the front that goes to minus 30 inches of mercury. Your aspirator will actually come to minus 29.6 inches of mercury at sea level, which is 1 atmosphere. And this is marked in inches of mercury here. Next, we have a control switch that controls the amount of vacuum that the aspirator is giving you. Then there's an on-off switch here, and a small port on the front that will take the pneumatic foot switch. Turning the instrument around like that, you can see the port, the inlet port from the aspirator, and turning it all the way around, you will see that there's a facility here for your power cord and a bracket that will accept the canister. Turning the instrument back around and sideways on. Now, you will of course receive with the aspirator a manual that will give you all of the information such as warranty and electrical capacity, etc. on the aspirator. And I'm just going to put that back to one side for the moment. Now, the first part that you need to fit on is your high particulate filter. This filter prevents any microparticles of fat getting into the operating room atmosphere. And that just goes onto the inlet port on the aspirator, making sure that that's a nice firm fit there. Sometimes you may need a piece of tubing to go from the aspirator to the filter, but in this case it's just a push fit like that. We're often asked, how often should I change my filter? No one really seems to know, but the industry standard is after 15 hours of use. Next, you will need to fit on the canister that slips onto the bracket on the rear of the instrument, as previously indicated. Then you take your canister liner. Canister liners come in various shapes and forms. This is a 1500cc canister liner. It comes from Medline. And it's a blue top, and that's most important because blue top canister liners have a filter in them and also a stop valve that prevents any possibility of any fat getting out of the canister liner back into your aspirator. If you get fat back into the aspirator, I'm afraid you basically got to throw the aspirator away and buy another one because they're very, very hard to clean. So the canister liner just fits into the canister like that, and a nice firm fit like that. There are a number of ports on top of the canister liner. This port here is the one that will accept the tubing that will go to the liposuction cannula and is marked patient. And on the center there is a port that is marked vacuum. The red tube just fits onto that vacuum port like that. Again, making sure it's a nice tight fit. You now need to connect the aspirator to the canister, and you do that with the piece of tubing that came with the instrument itself. One end goes on top of the high particulate filter like that, and the next part goes onto the bottom of the bracket there, like that. Turning the instrument round again, we now are fully connected. There is a little switch here that controls whether the suction is going through the canister. I've got it off here. I'm going to turn it to on like that. Turning the aspirator back round again. This aspirator, as I said, is portable. It weighs only just 3 kilos, so you could easily move it around if you need to do so from one room to the next. So the next part to fit on is the pneumatic foot switch. Very simple piece of equipment, just a bulb on one end and a piece of hollow tubing that just pushes on. It's just a push fit onto the nipple on the front of the aspirator like that. The last thing, of course, that you need to do is to fit the power source, which just goes into the rear of the instrument here, like that. So now it's all connected up and ready to go. When I turn the switch on at the front, you can probably hardly hear that, but the motor is actually going. It's receiving power. It's not until I press the foot switch that the aspirator starts to actually run. So I'll push the foot switch there, and you can hear it running now. Sucked down the canister liner, and you've got a little bit of negative pressure. Not a great deal because we haven't yet occluded the port that will go to the liposuction cannula. So only when I do that you will see this dial move up, and it will go up progressively to minus 29.6 inches of mercury. at sea level as previously indicated. Now with this dial here you can control the negative pressure you're getting. If you wish to maybe harvest stem cells from the fat that you've collected, you probably need to have that at about minus 15 inches, about half the capacity of the aspirator. So that's all there is to it. That foot switch should normally go on the floor, and when you want to turn it off, just turn it off like that. Release the pressure, dial drops down there. Now all aspirators are fundamentally the same. They're just suction pumps. They all reach the same negative pressure, that minus 29.6 inches of mercury at sea level. What differentiates one aspirator from another is the flow rate. This touch-up aspirator has a flow rate of 2.5 cubic feet per minute. Our larger aspirators have a massive flow rate of 5 cubic feet per minute. And that is probably fairly critical when you're making a decision about an aspirator, is how fast do you want your procedures to be, and that will really be determined by the cubic flow rate. Now, as this is described as a touch-up, it's not really meant for very large procedures, it's more for touch-up in your rooms. Thank you very much indeed, that's about it.